I've been to places where there's like mugwort pools and they do, I mean, will people sip it or drink it or soak it?
Yeah. But for this, it emits heat. It also transmits the properties of the herb through the acupuncture point. The heat emitted from the burning moxa stick has been shown to be infrared heat, so it penetrates deeper. And we use it to warm and treat an acupuncture point with or without a needle. And we can also use it to treat along an entire channel. Like my mom, when she was in her cancer journey, she lost feeling in the outer 2/3 of her feet because of full head radiation because of cancer lesions in her brain. And the doctors told her that she would not get feeling back in her feet. I used moxa only because she couldn't tolerate needles at that point. I used moxa only to treat her system and to disperse and encourage the movement of chi along those nerve roots. And we together got back the feeling in her feet after 3 or 4 treatments. So it's a very powerful treatment on its own. It's also what I use for warming myself up or like treating my digestion when I don't feel like giving myself a complete acupuncture treatment. Moxa is something that you can use on yourself at home. However, I highly encourage you to ask your acupuncturist to teach you how to do moxa on yourself at home, or go take a course, because you can burn yourself, you can hurt yourself, and having an understanding of the patterns of differentiation, so the way we, quote, diagnose patients in Chinese medicine is important.
And they also can work with a practitioner like you. They can go to a local TCM person to just make it easier, an acupuncturist, and have those conversations. Someone who is an acupuncturist who understands the inner workings of TCM. So good.
So I have on hand light panels. I have on hand clay infused towels that direct your body heat back to you as infrared. So there are so many different ways that you can have heat source on hand to help somebody become resilient to the cold. And I think that is, I feel like that's an important piece of the conversation between a practitioner and their patient. Like, hey, great, come to me for a session after and let's take a look at how it affected your system and how I can help you do this more mindfully, more safely, and partner in it rather than being dogmatic. No, cold is bad.
Yeah, and the thing is also, you know, the shiver response, we hear about the cascade that happens in the body, and there's ways that we can target some of that heat or just still have people go through the whole process of what they're experiencing from cold. The big elation that happens after, parasympathetic rebound, people are excited, you know, there's so much joy. It doesn't have to feel so technical. I mean, I always like to remind people it's like fine to play in the cold and use these tools in so many different ways and do it in community, of course. And at the end of the day, it starts to be like, hey, how can we do it's both and, like, just like big reincorporation from the beginning, it's both and. We have the opportunity here. Let's just be smart about it, right? Let's understand that context is king, safety is queen, that we have some heat sources. And for people who want to walk slowly through the door, everybody can walk slowly by adjusting time and temperature and just being mindful. I think a lot of this really speaks to, and I'm so thankful that you came on the show today, is because it speaks to the level of awareness we want to have, whether that be proprioception in the way our body moves in space, but just awareness to interoception, how we're feeling on the inside, what's going on in the body. Can we hear our heartbeat? Can we feel our pulse while we're either sitting in the cold or just breathing, you know, and all the ways that we can externally take in the environment. This is all our nervous systems are doing all day long. It's just reading millions of times every millisecond. They're just reading the room and reading everything that's happening almost before we can even think or breathe into that. And as a result, there's many theories that talk about how our space and our thought process and the way that our breathing and our brain neurochemistry and the thoughts that we're having, it's like, which comes first, the chicken or the egg? And I think really it is a lot of this, like, yes, we are externally checking in, but we are feeling the things that are happening that are triggering the nervous system. And by triggering, I don't mean any kind of heightened response, but just really feeling the temperature and everything that's on our skin and all of the things that are just riding through our body to be able to put us in an up-regulated or down-regulated state, wherever that might be.